What's up, guys? Welcome back to Worth the Wait. I am your host, Cookie Miller, and I am so excited for you to check out today's episode with Dr. Jessica Shepard. We talked all things women's health, including perimenopause, menopause, PCOS, holistic health. We even talked about weightlifting, and I have been on pins and needles waiting for this episode to drop so you could get an opportunity to hear from this incredible, incredible woman. So, in case you do not know who she is, Dr. Jessica Shepard is a board-certified gynecologist and women's health expert that specializes in menopausal health and is also the founder of Modern Meno Health. Her holistic practice, Sanctum Med and Wellness in Dallas, has created a space for patients to explore their holistic journey in optimizing health and has been featured in Self Magazine and Women's Health Magazine. Her release of her book, Generation M, this year will also create more buzz in the menopause world. Dr. Shepard is an engaging and well-known media personality that is seen regularly as an expert on Good Morning America, The Today Show, CNN, MSNBC, and CBS News. She is on the advisory board for Women's Health Magazine, womenshealth.org, and the Society for Women's Research. Listen, without further ado, let's get into this episode of Worth the Wait. What's up, guys? Welcome back to Worth the Wait. I am so excited because today we have Dr. Jessica Shepard, who I had the pleasure of meeting in person. Sometimes that's not really like a thing anymore, but she is out and about, and I got to meet her at the Good Soil Forum a few months ago, and she agreed to come on the podcast and just give us a wealth of knowledge because she is a wealth of knowledge. So, Dr. Shepard, welcome to Worth the Wait. How are you?
Thank you. I'm so glad that I'm part of Worth the Wait. I hope it was worth the wait for me. Episode to come. We'll see.
It's so worth the wait for me to get this opportunity to be here with you. As I told you when I ran up to you, and guys, this is so real. I ran up to her after the conference, like, please don't leave. She had her shades on. She was like ready to go.
I was gone.
She was gone.
Like, don't leave.
I was like, I have to talk to you because you are like a unicorn to me. I mean, my eyes were so wide, and this is not, I'm so serious about this. I have been at least doing, training in the more functional space for the past 5 years, and then have been training for the past 10 years. And I have interviewed, if you go back, quite a few medical doctors here on the podcast, but it has been so difficult to find particularly a Black functional medicine doctor to interview. And I'm like, where are we? Like, what are the hashtags that we're using so that I can find you all? So when you got on that stage and started talking functional medicine, I was like, I need to know you.
I love that. I think that, that's kind of how I came into functional medicine, as an MD and practicing Western traditional medicine for, years, over 15 years is, throughout that time frame, I realized that I had so much more to offer from the kind of scope of how people live their lives. It's never as, just one focus. If they come in for a disease state or a condition, there's so many other things that highlight why they're there or how they're navigating through it or what their journey is. And so the ability for me to reach those points is where functional medicine met kind of that criteria of me to be able to change the practice and how I approach women, because functional medicine's focuses really on understanding an individual's physiological, cognitive, emotional, physical function, and really fine-tuning all of that in order to design and implement this type of therapeutic program that's going to be personalized.
Absolutely. And I think, even when we say functional medicine, a lot of people are still kind of like, what are you talking about? So why don't you tell us a little bit about what functional medicine is to begin with, and then how exactly you transitioned from traditional Western medicine into functional medicine?
Yeah, I would say that I'm definitely a bit of both, because I still very much believe in, Western medicine, evidence-based medicine, how to treat people for certain disease conditions, how to operate. I'm a surgeon as well. But I think where the functional medicine, for me, how it came into play is really it evolving more of a patient-centric type of approach in how we align the understanding of what the patient is going through, and then also allowing them to navigate different pathways of how they're trying to find themselves in a different outcome. So, for example, we look at the environment, the diet, the lifestyle, movement, when I think of like exercise. And all of those play really important parts in a person's wellness journey and how they want to see themselves. In the future, how they want to show up for themselves. So, traditional medicine, because of the way it's fashioned, people come in and we like see a lot of people for short periods of time and we address one critical thing, or we're doing an annual and we look over everything and then that's it. And so, I kind of walk the talk in how I believe that health and lifestyle is really a big part of what you can do outside of the doctor's office. So, how I choose to eat and fuel my body, how I implement movement into my curriculum of life, as I call it, and then also emotional. And I would say that emotional health and mental wellness is actually one of the harder parts to understand and evolve in because we're definitely not taught that as a society in for women and especially in the Black and Brown communities. So I think that actually is probably one of the parts that I have to lean into much harder than I ever have for some of the other stuff. And then being able to share that with patients and teach them as well. That's a great part of it too. I'm learning too.
Yeah, I love that you brought up the emotional side of it, and the mental health side of it is something that I find that we often just completely leave out, even when we're thinking about the fitness space, which I know you're also in. I love to see all your workout videos on IG. But I think that's something that we forget about is like, how does my mental health, how I'm feeling, my stress levels play a role in how my body is reacting and whether or not I'm sleeping well, and all of these things. So would you say that that is kind of like the defining factor between maybe the Western side and the
Mhm.
functional side, is that you're more holistically focused?
Correct. More holistically focused, more root based. So you're really looking for like the root cause of why someone might have something, and then looking at other modalities other than just a disease state and maybe medicine or surgery.
Right, right. I know that's something that's very like predominant, especially in the Black and Brown community, is when we're thinking about diabetes or even
Mm,
pre-diabetes and forms of insulin resistance, which was something that you talked about a lot from the stage. And that was what really got me because as you know, I was diagnosed pre-diabetic and I had developed acanthosis, which started off as just that darkness around the neck. And I
mhm.
think in the Black and Brown community, a lot of times we see that and we're like, scrub your neck, like what is
Right.
that around your neck? We don't even know what it is.
Yeah.
So, how would you say you deal with something like diabetes or insulin resistance differently in a functional medicine
Mhm.
way versus in the more traditional way?
Yeah, so that's kind of like one of those things where it's an easy answer, but it's so much behind it. Nutrition. That's really where I see where nutritional science and nutritional value can really like change the game for anyone. And when you look historically at Black and Brown communities, either you're facing communities that are food deserts, you're facing communities that don't have access to some of the better foods that can do better for us. And then also, I think just culturally, there are some things in our diet that we could find ways to change or find alternatives, but it is hard. And I think also with the education of what leads to these disease states when it comes to nutrition. So that's a big gap, I would say, in how we look at food, the relationship that we have with food, but also the access that we have to food. And so that to me is an environmental part of the nutrition kind of realm of Black and Brown communities is that we have not been afforded, we have been left out, we are not given the full capability to have foods that are actually more value to us and decrease disease states and conditions like high blood pressure and diabetes.
Yeah, yeah. And then also, I think those things have been normalized as
Mhm.
well. One thing that always stands out to me when I think about diabetes in general is when my doctor, first, I went to a dermatologist, which
Mhm.
I'm like,
Mm.
what is this on my skin? Give me cream or something. And luckily she was very well versed and she understood and she was like, I think you need to go and have a blood test by your PCP. And I'm like, huh? Like where's
Mm-hmm.
the cream or whatever that I need?
Yeah.
Something I can apply topically. And so when I went to my doctor, I had a relationship with her. So she knew about my family history. And
Mm-hmm.
she said, listen, if you do not change the way that you're eating and the way that you're not moving, you are going to be shooting yourself up with insulin the same way that your
Mm-hmm.
grandmothers did,
Yeah.
right?
And
Because
and
then, yeah,
imagine that message to you, like where you are and knowing what, your mother and or your grandmother went through and hearing it. So I in that even in that story that you share, I see the opportunity and the kind of privilege that you had with that because they didn't, right? It just kind of like, oops, now I have it, where you got the foresight to being like, oh my gosh. One, that your dermatologist was able to being like, up, nope,
yeah,
straight to PCP, get your blood checked because this might be a possibility. And then fast forward into I did see my PCP, getting the information, but linking it back to, hey, this was family history. So you have an increased risk of having diabetes. Kind of those are the conversations that I think are so imperative, important for our community is like the foresight and the ability to change the direction.
absolutely. Absolutely. Being able to be preventative in some way. Because
Hmm.
oftentimes we find ourselves at a place where at this point you need the medication.
Correct. Yeah.
There isn't much that we can, I mean, we can still change the lifestyle, of course, but the medication is going to be more important at this point. I think
Mhm.
this is a really good transition to kind of talk about some hormonal health issues that can also stem from insulin sensitivity, like PCOS, for example.
Mhm.
I know is something that's really becoming more and more common. I don't know if people are just becoming more enlightened with there being so much education online and they're going in and testing and asking, or if there are environmental factors and other factors that are causing there to be more cases of PCOS. But what would you say your approach is when treating something like PCOS?
Yeah, just to give context, PCOS is polycystic ovarian syndrome. And just so, people are aware, the word syndrome, when we use that in medicine, means that there is other things that are impacting that disease state. So I kind of hate the term PCOS, and I'll tell you why. It says polycystic ovarian syndrome. So everyone hyper focuses on this cute little ovary causing all these problems. And the reason why, the term is what it is because it does create some issues with periods, menses, and fertility. So I wish I were there when whoever was naming it named it because I would have been like, hey, but there's other things going on. And that's where people miss kind of like that it impacts how our body functions internally. And that's what you were speaking to earlier about the resistance to insulin. So if I were to give you more of like a functional look at PCOS, it really has a lot more to do actually with the metabolism internally with our body when we think of insulin and glucose, which are kind of like how your body processes glucose, the ability for you to get glucose where it needs to go to. Glucose is really a fuel. And so when we take it in food or however we get it, it is supposed to be shuttled to different parts of our body for our body to function. It's a source of energy and fuel. But typically, what happens when we think of it as an endocrine condition rather than an ovarian condition is that there are like kind of like foundations of PCOS that would help people take the focus off the ovary. So, obviously, you have the hormonal part that has to do with your sex hormones that are reproductive. But then you also have your insulin resistance kind of pillar when you think of PCOS. And then also obesity. So, obesity, not everyone who has PCOS is obese, but the impact of adipose cells or obesity actually increases kind of the impact of what PCOS can do. And so, with all of these kind of different criteria and what's going on in the body, that's where we start to see the function. Everything is connected in the body. So if one thing is, malfunctioning, then it will trigger something else that will not work as well. And then you just keep going. It's like a domino effect. And so with all those things going on when, that I just mentioned, that's where you start to see the body responding to the insulin resistance. And I'll just quickly explain insulin resistance. So it's almost as if I think this is the perfect analogy. If the mailman keeps coming to your house, but the mail just keeps stacking up because no one's taking the mail out of the mailbox. And so that's the same thing with insulin and glucose. So you have insulin that's going to be able to help shuttle glucose around, but the organs in which it's, impacting are resistant to it. It's like, yeah, I see you insulin, but I'm not even responding to you. And so, with that, the insulin resistance is that your body then can't function the way that it should because it's not getting the message or it's not taking in the message that it should. And so, that's where you start to see the breakdown over time of how your body will function, which would then increase your risk for hypercholesterolemia, hypertension, type 2 diabetes, heart disease. So, then over time, it's just this buildup. Not necessarily of insulin, but just how the body functions. And then the body can't function the way it is and it should. And then that's when you start to see diseases come over time.
I love the mailbox
Yeah.
analogy. I've never heard that one before. I think that's a really great way to explain it. It gives you a great visual to better understand. So that makes sense when we're talking about the insulin resistant form of PCOS. Now, I don't know what your opinion is on this, but I'd love to know
Yeah.
what your opinion is, or what the evidence is behind there being these different types of PCOS, where there's like the adrenal PCOS, there's
Mhm.
insulin resistant, there's PCOS that can come post pill. Have you seen those differences, and kind of how does that?
I think that when it alludes to how you were just describing it, is that there can be different manifestations of PCOS. So, for example, and I kind of mentioned it, alluded to it before, is that not everyone. So, typically, a lot of people will be like, oh, you don't look like you have PCOS. And because sometimes there are these features that, kind of raise the suspicion of PCOS. But I've had plenty of patients who come in like slender, don't necessarily have any like issues that you see with like oily skin, maybe, or maybe they have their period every month and then they have PCOS, right? And so it kind of is this manifestation of how it presents in different people. And so I do think that that kind of can kind of be in like the subcategories of PCOS is how does it present? What are the obstacles that a patient might present with based on the expression of PCOS that they have?
Yeah, that makes sense. I've always seen like the different types of PCOS, and I'm like, what really is driving that, or what's behind that? So I appreciate that explanation. Now I want to ask you about something else that comes up quite a bit, especially here recently, which is inflammation. We're always
Mhm.
hearing about inflammation, lower your inflammation. Now I
Yeah.
know inflammation has some good things as well,
Mhm.
like it
Mhm.
offers us some benefits, but there's a problem when there's a buildup of too much inflammation. So what have you seen in your practice? And then maybe what are some tips that you can share for us to reduce our overall inflammation in our bodies?
Yeah, I think, just to take a step back when we think of inflammation, I think a lot of people think like, when you're swollen, when you have something wrong with you and you're like, oh, you're inflamed because you can visualize it. When we talk about inflammation from a physician standpoint, we're really talking about inside is inflammation, but it doesn't look like inflammation. It's a cascade of events that actually occur from cell to cell that causes your body to be just kind of angry, mad, right? And so any organ can really be inflamed. And inflammation, what we really see is the broad context of it in the sense that your body is now so kind of out of its normal state. It's a little bit like frayed, angry type because of inflammation for many reasons, which can cause inflammation that it starts to have a contribution to how your organs and how the physiologic mechanisms of your body respond. So, for example, inflammation can lead to gut health, right? So, people who maybe are always bloated after eating or they have an issue with their bowel movements, right? That can be inflammation from a gut perspective. Then you can have people who have inflammation of their vessels, right? So it's an inflammatory process that's occurring. And then they have high blood pressure, or it starts to create plaque inside the arteries, which can lead to coronary artery disease. Or you could have inflammation from the kidneys, and that can, again, cause the kidneys to respond and hypertension to give kidney disease, right? So it's all these little cells that are supposed to be keeping things calm, like you said, inflammation can be good because that's a response of the body. It's a normal response of the body. But if everything is inflamed for a very long time, sustained, and it doesn't have any areas of rest, that's when we start to see the organ systems being like, I don't even have any downtime. I'm just always in this kind of like fire pool, and it's never calm. So they don't have the ability to kind of do what they need to do, calm down, and then respond to inflammation when it comes. So again, those are things that happen internally that's not visible, but we start to see it when people start to have disease.
Got it. So you're saying, like, for example, if someone is a heavy drinker
Hmm.
and there may be a lot of pressure that they're putting on their kidneys and
And
their
liver.
and liver, then in that sense, they're going to have inflammation within those organs. And then does that spread throughout the body, or how does that work?
A lot of time it cascades, right? So it's the same domino effect. So, for example, someone who's a heavy drinker might have liver disease because over time the liver's like, I can't do any more work. It's just too much. I can't do it, and so that can kind of go into disease, maybe with the pancreas, which is close by, or maybe because their liver is not functioning the way that it should. Then they start to have a buildup of like kind of overpass of what the liver can't detoxify. Like the liver is responsible for cleansing and detoxifying. And so if it kind of shuts down, then it can go towards the kidneys because it's like, well, I can't clean this out. So I'm just going to have it and it's going to overrun. It's like a pot and it just keeps boiling over because it's like, I don't have the ability to turn off this oven. All you have is in high heat and it's never coming down. Right. And so
That's
that's when the cells are like, I can't help anymore. And then all the other organs start to be kind of, they take on the heat. Right. And they're just like, well, that's overflowing over there and it's coming over in our pile. Yeah.
so then there's kind of just this systemic inflammation
Hmm.
within the entire system.
Hmm.
That is just like,
The
my
body
mind.
is amazing, I tell you. And so that's what I do love about medicine is because we know the body and the organs is at such a granular level because we spent so much time studying it, so much time. I say that laughing, but that was really like a trauma moment. But because we spent so much time studying the body, how it responds, what it does, and the processes that it does, that you actually know, when someone's in a disease state and you start to see some of the organs start to fail. Or on the flip side, which is what I prefer to talk about, is when we see someone who's able to thwart off inflammation rather, that's with their change in diet, exercising, maybe they're taking some medications to help offset some of the inflammation, and then you start to see that person recover, right? So it's always this kind of balance, this scale of what you decide to do, which are going to be things that help the disease process and inflammation, or the things that you don't decide to do. Everyone has a choice. And with that, what comes with you not doing the things, then that's sometimes bad outcomes as well.
Yeah, yeah. I see a lot of what you post online about menopause,
Hmm.
especially. And I'm always interested in that because it's coming.
Hmm.
Where all of us as women, we're going to go through it.
Yeah.
Some of us even go through it younger if we've had to have a hysterectomy or anything like that. I wonder if you see a difference in your patients who maybe suffered with PCOS or endometriosis prior to
Hmm.
menopause, and also just what can all of us as younger women do to make sure that we kind of gracefully enter menopause, if there's a
Hmm.
such thing.
I think there is. I'm like have like high expectation that we can change the narrative of what it means for a woman to go in menopause. And so kind of like I've done, in the last topics we've discussed is really just to give a frame to what menopause is. So menopause really 100% of women will go through menopause, by the way, but they will experience it differently. But menopause really is a very clinical term. And when I say that, it means for women who are starting to change the regularity of their cycle. And then they start to not have their cycle. And then eventually they get to a point where they've had 12 months consecutively, meaning back to back to back, of no cycle for 12 months. At that 12-month, basically, we can say you're menopausal. And it means that the amount of estrogen from the ovaries that are released that caused us to have a bleed or a cycle is no longer there, and it's not enough to give us a cycle. And so when that happens for 12 months consecutively, that's when we start to be menopausal. And after that, like after it's kind of confirmed or determined that you've done 12 months of no period, after that you're postmenopausal because it's kind of just like a hallmark. It's kind of like a day where you're like 12 months I'm here, and then it's postmenopausal. So coming into menopause is usually through your 40s is when your hormones are starting to kind of taper off, and you might have some symptoms here, there, they're infrequent. And as that's starting to happen, that's a lot of where I tend to base my emphasis on. And the reason is because for so long, women would just wait till they're menopausal. And then it was like this influx of all these symptoms, and it was really hard to manage. No one was talking about it. It was like the deep, dark web of what's going on. So now we've kind of expanded the ability to have those conversations. But I really want to focus on my perimenopausal women because I'm like, we have the ability, right, to be preventative. We have the ability to have advice on how to ease your transition during this time frame. And those things don't always have to be medications. And this is where the functionality of what I practice comes in. And how do we change your exercise, whether that's increasing the amount that you do, changing the way that you exercise, because we need a little bit more weight training and resistance training. How can we change your diet? How can we improve your sleep because your sleep might start to suffer? And how can we get you to understand the full scope of what's going on from a full body perspective and get you invested in it in the sense that you're preparing and it's not a scary thing that's going to happen? I find that when we educate more, when we are more preventative, when we're able to give people more advice on what's coming, then you're much more open to the possibilities of what that can look like rather than like last minute, 23rd hour, we're like, oh, yeah, by the way, you're going to be menopausal and it's going to suck. I mean, no one wants to do it that way. And so that's why I try to change the narrative and not make it such a horror story.
Right, right. So have you noticed like any differences when you're looking at those who maybe had PCOS or they had endometriosis prior to entering into their menopausal
Hmm.
state? Is there a difference? And do those women have to prepare differently than women who maybe had healthier years during their period?
I would say probably PCOS is kind of give you more of a ability to maybe have things that are going to happen in the menopausal phase that are not as quote unquote friendly, say. Endometriosis, to give some definitions to that, endometriosis is a disease or a condition, rather, that is chronic inflammation within the pelvis, but it is fueled by estrogen. And
Mm.
so estrogen, which I dearly love, I think it's amazing. In this instance, is not doing exactly what we would want it to do, and it's not being very nice, I could say. So the thing that I would say about endometriosis or the patients that I've dealt with endometriosis is that actually when they get into the menopausal phase, they actually do better when it comes to maybe pelvic pain, discomfort, etc., because the estrogen is decreased, right? So they're not really getting that inflammatory marker that the estrogen was causing. And so a lot of endometriosis patients, and even how we manage them when they are having their periods, we're actually trying to decrease estrogen. So typically those patients and those women will have a better experience of transition into menopause because now the pain feature may minimize or go away altogether. Now, for PCOS, as we discussed, a lot of it has to do with insulin resistance, inflammation. And so, what we do find and is as PCOS patients cross over into this menopausal phase, is they do have increased risk of getting diabetes. Their body's already shifting biologically outside of the PCOS factor into an insulin resistant phase, right? And so PCOS kind of carries those features, and also with obesity, right? So there tends to be predilection or an increased risk of having obesity with PCOS. And so I would say that your body biologically outside of PCOS also starts to increase its desire to be not fat loss, but more fat gaining. And so again, you'll start to see more of a shift towards those things in the perimenopausal and menopausal phase. And so that can be quite frustrating for PCOS, women who have PCOS.
I'm just excited because when you said it gets better for the endometriosis girlies, yeah,
You're like, yes, yes, tell
yeah,
me more. Yeah. Yeah, because
I love
estrogen
that
again is
part.
that kind of offending factor in the disease process. Yeah.
Yeah, yeah. Well, I absolutely love that for us. Look, endometriosis girlies, we get that's a positive,
Yeah,
something.
I'm like, take one for the win.
We'll take it. We'll take what we can get.
Yeah.
Well, look, I know that you have a book coming out. I don't know how
Yes.
much it's geared more towards menopause, right? I
It
want to
is,
say,
so it's called Generation M and it is geared towards menopause. But like I said before, it actually is for in the perimenopausal phase. So for me, that can be in your 30s or 40s, right? So this is kind of the book where I really wanted to highlight it's evidence-based. It has a lot of science in it, but it's a lifestyle oriented. And the reason why is because I want people to get to a point where they're like, the perimenopausal phase is hip. I can still be cool while I'm, going through this transition. And so the more you know earlier, the better you can do as it starts to come towards you. And so I would say it is not necessarily geared to women who have been through menopause, although they can read and still get really good insight. My kind of ode to who I am as a perimenopausal woman and a lot of my friends and patients that I see is what can I give to women who are not quite there? How can we decrease the education gap? And also, how can we give them the empowerment and motivation to start to do the lifestyle measurements that's going to make that transition even better than they ever thought?
Mhm. That's exciting for me because it kind of sounds like a little like pre-menopausal or perimenopausal Bible
Mm-hmm. Mm-hmm.
that you can just have and take along with you and be prepared for those
Yeah.
years because so many women enter menopause and they're like,
Mm-hmm.
what is this? I'm flashing, like I have completely changed as a person. So I think it's great that you put together something that we can all use as women to be able to transition into menopause
Mm-hmm.
gracefully.
Yeah,
So
I
I'm
really
looking
wanted it
forward
to
to it.
be kind of like a handbook and, kind of like a work of art. We really wanted it to be artful. We really wanted it to be practical as well.
Yeah, yeah. Well, I'm looking forward to that. It's coming out in October, right? What date is it?
Yes. So September is Perimenopause Awareness Month and October is Menopause Awareness Month. So October 1st, we are like big and bad. We're right there in your face on the 1st of October. We're going to be in Barnes and Nobles. That's, our publisher, Union Square and Company. So we're really going to be seeing that in some big bookshop shelves. And yeah, we're going to do a full media tour and a book tour. So look forward to that.
You guys, you have to make sure that you're following Dr. Jessica Shepherd on Instagram. Her IG is like, I just live vicariously through her. The workouts, the girls' days on her stories, just everything is so fun, it's educational. And I just absolutely love it. I thank you so much for being in this space and for being someone that I can personally look up to in this space. And so many of us as Black and Brown girls can look to you and say, look at her, look at what she's doing. You're so inspirational and motivational. And
Thank
I think
you.
I speak for all of us who will watch this later when I say that we just love you and we're really grateful to have you.
Thank you so much. I really appreciate that because, again, I think, in any aspect of women's health, I really see the lack of, the inability of information, access, resources for Black and Brown women. And my goal really is to kind of create this equilibrium of as much resources and access that we see in other communities that we also should be able to have that. And so whether it's when I'm on TV on GMA or Today Show, whether it's I'm doing keynote speaking or even through the book, is to always remember that the community of Black and Brown women are so important. And I want to make sure that they get just as much information and just as much community that we see in other communities through health and wellness.
Yeah, yeah. So what else do you have coming up? I know you have so many things going on. I want to make sure we don't leave anything out. So tell everyone where they can find you, where they can follow
Yes.
you, how they can come see you.
Yes. So again, here in Dallas, and like you said, my Instagram is kind of like my ability to showcase what I do every day, who I encounter, the amazing people that I meet. And so that's on Instagram at Jessica Shepherd, MD, which is SHEPHERD, MD. And then for menopause, for women who are in perimenopause or menopause transition, I have another page, which is Modern Meno. So MODERN as in modern, and then Meno, MENO. And there I really just like to highlight menopausal and perimenopausal information. We have the book coming out in October. And even up until then, I am really going to be traveling a lot, doing a lot of TV spots, GMA. We're going to be doing more of those. And then in the late fall, we are going to be doing a lot more wellness type of activities and conferences. And so I'll be traveling a lot for more wellness, which is what we were alluding to, the lifestyle portion of it. What can we do through movement, through exercise, through brain work, through breath work, through yoga. And I think that's all part of this experience. And so that's really important to me as well. And then here in Dallas, I have a practice, Sanctum Med and Wellness. We are here in Central Dallas on Lover's Lane. And we are also on Instagram and TikTok. So I love that my staff pushes me towards TikTok. So I'm like, what is this and what's going on? And so we are there on TikTok, Sanctum Med Wellness. But here really is kind of like the hallmark, the brick and mortar of everything that I believe in. And we're able to guide people through whether they see me from a gynecology standpoint. We have a nutritionist, we have yoga instructors, we have massage therapists, we have aesthetics. We also have two licensed therapists, and one of them does ketamine therapy. And we have an acupuncturist who does traditional Chinese medicine. So that really is the scope of how people should see themselves at all times is whether I need my medical, visit, whether I need to talk to a doctor about a condition that's going on. I also need to take care of the other aspects of my entire life, and that's what we do here.
I didn't know that.
Yeah,
You
I'm
always
here.
just like, I'm like, wait, you are changing the game of what it means to go to a doctor's visit. Like, you're telling me I can go to my doctor's visit and then also get acupuncture
Yeah,
and then take a yoga class.
yeah.
Oh my gosh.
It's
Need to move
really
to Dallas.
it's I really just it's almost like when you see it and you're in it, you can't unsee it. And so, because I was so deep in the wellness world, before I started Sanctum and I was in traditional medicine, I really was like, how can I get this to my patients? Like, how can I get them to see so much more of exposure to what they can do for their life that doesn't have to be a dreadful doctor's visit? And so that's what came out of just the dream of Sanctum Med and Wellness. And we just passed our 3rd-year anniversary, and we're so excited. And on top of that, we're like, well, who wouldn't want to look at? So we have the aesthetics of Botox, fillers, hydrofacials. We have all that PRP. We do all of that here, and we want people to feel good about their health.
I wish I'd known this when I was in Dallas. Like, now I have to take a special trip
We
back
do
to have an entire spa day. It sounds like, really.
a whole spa day. Yeah.
I love that. I love that. I'm going to ask you, just like, I'm a trainer, so I've got to ask the trainer questions. I have seen you online doing all of your lifting. I love that you're telling women to lift heavy.
Yes. Lift
Key
heavy.
word, heavy weights. She said, do not pick up those 5-pound weights. So
Don't.
I absolutely love that. How did you get into lifting? Like, where did that come from? And then I want to know what your favorite lift is.
Yes. Okay. So this all started. This is kind of like you would have had to listen to this whole podcast to listen to the secret tip about myself. So when I was an undergrad, I actually graduated under exercise physiology. Yeah. And so for a year, I did exercise physiology training before I went to med school. So I was always very aware of like what the body can do. And obviously going to med school, like hyper focused on, how the body functions and disease state. But even when I was in a latter part of medical school, I personal trained on the side because I was like, I can make some money, but I also know how to personal train. And then fast forward to, I've always been just open to pushing myself to be the best, physically, because I know what it can kind of garner me in the future. And so I always knew that this would be a big part of my life. And so that's why also in me trying to convey that message to others, especially for health, like even in the medical field, we could do better because we're like, we'll talk about heart disease, but we don't look like we are someone who advocates for the best ways to prevent heart disease. And so I said, in order to be able to best showcase to my patients, I have to do the thing too. And so, committing to that is important. But yeah, I've realized the impact of lifting heavier weight as I start to get older. I'm almost 50. And so I started lifting heavy weights probably And about 2 years ago is when I really started to increase weight because I used to do a ton of cardio. I was a runner and I was like, I love running. And then I'd do like lighter weights, like, 10s, 15s. And now I'm like really getting up there to the 20, 25, 30. But yeah, I like that quick fire question. What is my favorite lift? I would say I used to hate doing a deadlift because I felt that my form was like horrible. And so I took the time to kind of perfect it. And it really is like a total body kind of lift because you get so much in the lower body, but you also are working the upper body in addition to your back. And so I say that's my favorite one because it's so whole body and I was afraid of it at first.
Wait, listen, we have all been victims of a bad deadlift,
Yeah,
and it is not fun. It
I
is.
know.
So yeah, yeah, that's a win. That's a huge win to have
Yeah.
accomplished. You got the deadlift down, so you're good to
I
go.
had to, yeah, to ask a few people. And then when I first started, I would like go over in the corner and like try one. Then I would watch people and I was like, this is ridiculous. And then I stopped for like a while and I was like, forget it, I'm not doing it. And then I was just like, you've got to do it. So yeah.
Well, a couple years ago, I got COVID pretty bad and I was out of there for a while. I actually ended up with long COVID and I had developed like
Wow.
a little bit of fluid pericarditis around my heart. Very, very scary situation. So I
Wow.
couldn't exercise for like maybe 2 months,
Oh,
which
I feel your pain on that one.
oh my
That's horrible.
I was like, I can't do anything. What do you mean? I kept asking the cardiologist, like, are you sure?
And he was like, yep.
Um, and once I got back in there, I was like, oh, okay, now I see why I could. I mean, because my heart rate was high off of like the smallest little things. But I'm a trainer and I've been doing this for 10 years. So I was like, you know what? I'm going to deadlift.
Yeah. And isn't
And
it amazing like going from where you were long COVID not working out and then having to build your body back, but it does it. Like it really can do it if you just like stay tried and true and do some small steps and consistency. That's kind of like one of my favorite words is consistency.
small steps. I didn't
Yeah.
do that. I didn't do that, Dr. Jessica.
You
That's
didn't
what
do
I'm
the
trying
small
to tell
steps.
you.
You
I
went
didn't
straight
do
to
the
like,
small steps. I went straight to like maybe like a 80-pound dumbbell. Okay. And
well, I'm glad you're putting it out there in the public. Now everyone
I'm
knows.
putting it out there because listen,
We
make
should make a
mistakes.
disclaimer. Don't do what she did.
Don't do it. I'm going to tell you why. So I went in and I did that. The last like RDL I was doing with this single dumbbell, and I put the weight down. The exercise is over. I just put the weight down and stood up. And when I tell you I was stuck,
Are we shocked? Are we shocked now?
I couldn't move. I was
Again, do not do what she did.
Don't do it. Don't do it. It's so not worth it. Your body absolutely can do it, but like Dr. Jessica said, small incremental steps. You've got to build your way up, especially if you've been out for 2 months. But hey,
I love it. I love a story where you're able to kind of tell your fall and then your rise, right?
yeah, yeah. The point is, I got it together. I got back.
I love it.
So yeah, we appreciate you so much. Thank you so much for your time. Thank you for being on Worth the Wait. October 1st, you guys, the book is coming out. So make sure you're following Dr. Jessica on all her social media platforms. Go find her on TikTok because I feel like I feel like her staff's
Yeah.
doing some crazy trends and I need to see that.
They come in here all the time with, did you see this on TikTok? I'm like, no, because I wasn't watching it. So they have to tell me like, here's the thing that we're doing and you need to stand here. And I'm like, okay, fine. I did start a personal TikTok. I think it's Jessica Shepherd MD. I don't even know. But I started just like figuring it out, I guess. But it is a very hard platform. I will be honest. I'm not, I don't know what I'm doing.
You're perfect for it. In that video we were talking about earlier before we started recording,
Yeah.
where that should go.
Okay.
That audience, I tell you, the TikTok audience is way more receptive to that. You don't have to be as like,
right, as polished as
right.
what we're talking
Instagram
about
is like,
today.
bring your best self, put on
Yeah.
makeup.
Okay,
TikTok is
I'm gonna
so
take your
chill.
word for it. I'm gonna take your word for it.
Yeah, you should. You should. All right, guys, we'll see y'all next time. Maybe we'll do a part 2.
Yeah, I would love to.
Bye.
Bye.